Hi, everyone. Thank you for coming and spending your lunch hour thinking about not so exciting um, or not so uplifting topics, I should say. And I wanted to make a note before I dive in to say that I first started working on this work as a result of a brown bag in fall 2020. And so that was when Bree Williams and Steph Bertozzi presented about their work in going in and looking at conditions during the COVID-19 pandemic in California corrections facilities. And I got involved in that with my colleague Rachel Sklar, who's also a part of this project. So I'm going to be talking today about climate change in incarcerated populations, exactly as the title says, looking at carceral settings and occupational slash environmental hazards, which is a little bit, that's a distinction that is a little bit difficult in prisons, occupational versus environmental, that is. And a comment about myself for those of you that don't know me. I am a researcher, associate researcher in Environmental Health Sciences Division, and I'm also the co-director of the Industrial Hygiene Graduate Training Program, which is part of EHS and also part of COEH. And I am an industrial hygienist as well as an industrial hygiene researcher. And so that may bring you right to question one, which is what is industrial hygiene? And so industrial hygiene grew out of this idea that, of course, as long as there have been people, we've been working. And as long as we've been working, we've known that work can cause injury and illnesses. And so we see this in the prehistorical record and skeletons that have certain patterns of wear. A month or two ago, I read this fascinating article about how skeletal remains of Egyptian scribes showed how their crouched and folded work position left marks on their bodies that you can see on their skeletons. And so we've always known that work can do damage, and we've always wanted to make work as safe as possible. Almost always, I would say. But I think for every worker, they want it to be as safe and healthy as possible. And at first, it was like we wanted to make it safe so that we could live to see another day. For people who caught, collected, and raised their own food and shelter, that was a direct relationship. For others, like the enslaved bricklayers pictured here, it was to earn their food and shelter. And naturally, the earliest surviving records of health reports include documentation of work-related injuries and illnesses. So what makes industrial hygiene different from this, and why does it have this name? And so the Industrial Revolution started in England with the textile mills. And this is just giving an example of what industrialization does to the worker. And so these mills moved from the work of making thread and cloth from literal cottage-based that's a hard one. Cottage-based industries into a centralized mill where hundreds of people were working. And this was brand new and driven by the desire to turn a higher profit and control the labor force. So the basic impulse to protect one's workers from injury was not really present in these early capitalist endeavors. And so initially, the combination and intensification of work meant that some exposures to hazards were magnified. So, for example, a single worker doing the carding of a fiber, which is where you can have to line up all of the fibers so they're all facing in the same direction so you can turn them into thread. And you can see that in the hand carving on the left. And it was done sort of pulling them. It's an essential step. And that evolved into somebody made a spinning drum where you could put it on a hand crank. And from there, that evolved into these giant enlarged machines that did carding. And so you can see they were bigger, so they could handle more stuff at once, more fibers. And then they were all put in one room, and they were run on steam operation. And so you can see that everything was intensified and sort of concentrated. And so you can see the fibers hanging off the overhead beams in the left-hand picture, and the bits of fiber all over the floors. And just an aside, there was a famous novel, The North and South by Elizabeth Gaskell, that depicts the workplace conditions of the 1850s. And so there was a knowledge then of the association between lung conditions and working in cotton mills. But a factory owner themselves could decide if they wanted to take any measures to protect the health of their workers. Some cotton mills owners would install a fan at one end of the carding room to carry off the cotton dust, but many chose not to, as it was a large expense that basically brought no profit. The journal The Lancet noted in 1863, a carder seldom lives in a card room beyond 40 years of age. Many have to give up working much earlier. And so the illness caused by inhalation of carbon fibers is called bisonosis, and it causes lung damage similar to asthma. So it was under working conditions like this that people began to think about industrial hygiene as a focus. So it was industrialized work, and hygiene at the time was sort of thinking about cleanliness and clean conditions. Um, and so today, I have messed up there we go. Today, industrial hygiene has been sort of organized into this field where we have certifications and instruction that is teaching people how to anticipate, recognize, evaluate, and control exposures to hazards in the workplace. And we do that in a variety of ways, and I'm going to talk through what that's like in prison settings, particularly in California. And the sort of cornerstone to how we think about handling these exposures and controlling or mitigating them is using the hierarchy of controls. And so the hierarchy of controls, as you can see here, starts in the blue with the most effective intervention, which is to physically remove the hazard, elimination. And then you move down through to the least effective, which is personal protective equipment. And it is generally written into the law that you must exhaust all reasonable effort for the highest, most effective control before you move down to the next one. So you can't just decide, oh, we're going to start by handing out respirators to everybody. You've got to show that you cannot do the higher, more effective ways of controlling exposure. Okay, so the other piece in my talk is the carceral setting. So carceral setting just means the various different ways in which people are incarcerated. And so those are prisons, which are long-term facilities, and where people go after sentencing. And there's jails where people spend a lot of time. Those are county, city, sometimes federal, and they are usually pre-sentencing, sometimes often pre-trial. And the other carceral settings are juvenile detention centers, immigration detention centers, and of course, private residences have been turned into carceral settings in places by using house arrest and electronic monitoring. So it's a big organization, the prison industry. And so this just shows a picture of one of the prisons we have in California, Wasco State Prison. And so how many people are we talking about? A lot. In the United States, we've got almost 2 million people locked up in the residential population. You can see the breakdown of where they are. The majority of the resident population is in state or federal prisons and federal or local jails. And you can see that about a third of people in carceral settings are in jail awaiting trial or sentencing. And as we go through this talk, the jails tend to be less well provisioned as far as the built environment goes and for resources for individuals than prisons, because prisons are there to hold people long term, whereas jails are designed to be very short term. And you may have read some things about during the pandemic when prisons stopped accepting newly incarcerated people, that jails had to hold on to them, and they were really not set up for that, and that caused a lot more illness and pain than was intended. So in California, it looks much the same as it does nationally. We've got about 200,000 California residents are locked up in various facilities. About half of that is in the prisons, and the other half is in either a local jail or a federal prison. On the right, you can see a map of these institutions, and the dots represent all the different locations, as well as ICE detention centers, juvenile facilities, and fire camps. The black dots are county jails, which are where most of the residents, like I said, are awaiting trial or sentencing. So those are, in effect, those are free people. They are not, they are innocent, but they are detained. The red dots are California Department of Correction and Rehabilitation, or CDCR locations. The orange dots are fire camps. And you can see from this map that there is a carceral institution. They're all across our state, and that many of them are in zones, if you know California, where you may suspect that climactic conditions are extreme during at least one part of the year. And I'm going to note here that I'm not going to spend a lot of time talking about the problem of um, and the challenge of incarcerated people working as firefighters. I'm focused mostly on indoor exposures. So they are exposed to wildland fire when they are resting at fire camps. So they are part of that piece. But I'm not going to directly address the issue with them and their work. And so, how big are these populations? We talked, and who are they? I talked a little bit about that in the previous slides. I'm just going to give some statistics for people that like statistics. Um, so, the first largest group of people are incarcerated people, and they are about 97,000. This is obviously a snapshot. Um, they are, spread out across the age group, but they are an aging population. Um, Insofar as that there are many more people now over the age of 50 and 60 than there used to be, and that presents a lot of different vulnerabilities. You can see what you may already know on the right, which is that the representation by racial and ethnic groups are not the same as those in the free population or in the overall population. And so that is something to ponder as you consider what types of vulnerabilities and risks may be magnified. Another large group of people that are present in prisons are those that work there. A lot of them are custody officers. They make up the biggest proportion, 46%, but there's also a lot of people who work in healthcare, nurses, doctors, and operations folks. There's some education, and then there's contractors who do a variety of tasks from, construction to healthcare. And then there's a group of individuals, not as many as either the other previous groups, but people who both live and work in prisons. And these are people, you've got people who are working in like shifts in the kitchen and things like that. But these are sort of additional jobs that you can work with the Prison Industry Authority, whose mission is to train people for when they are back in the regular population. And so they have a variety of things. This is where the wildland firefighters are employed through, I believe. And this is also, like in the Central Valley, we've got people doing agricultural production. There's, you can see fabric products manufacturing is one of the largest parts of the Prison Industry Authority. And so there's a variety of other jobs that people do that may put them at increased risk for climate impacts. And then just a note that prison labor is often required, things like shifts in the kitchen and various things like that. And often people aren't paid very much for their work, and if they are paid at all. And so that is still true, and is true in California. Okay, so the part that brings us together is, of course, what are the exposures? And so we're looking at climate-related hazards. And the first, most obvious climate-related hazard is heat. And heat illness is what's caused when you're overexposed to heat. And so these are the clinical aspects. I'm not really going to go through them, but heat rash, heat cramps, fainting, heat exhaustion, and then heat stroke, which is a very serious outcome that often results in death, and a minimum of long-term problems that are severe. And so in prisons, the exposure can be quite bad. And so people are trying to look out for this. Some of the things that protect you a little bit from heat exposure is heat acclimatization, which is that over about 14 days, your body will get used to heat. It doesn't protect you from extreme heat, but you can see that it does change some of the ways in which you regulate that heat and can handle that heat. And so that is another thing to know about as you think about heat exposure in carceral settings. And so you might ask, how big of a problem is heat exposure in these prisons? And so this, I get to just tell this short story from earlier this year that, or last year, I think actually, that gives us a little bit of understanding of how it's going. So there is a women's prison in the Central Valley and in Madera County, and this shows a picture of the women on the yard at Chowchilla, and a woman collapsed while she was actually taking a shower to try and cool off, which is one method I'll talk about later. And they called their advocacy group on the outside and said, you got to help us, we're dying in here. And the inmate that called said that it was heat exhaustion and described what had happened to her. And so if you look at the days that this happened, you can see that it was very, very hot. This is showing the CDC's heat-related heat risk map, showing the woman was transported out of Chowchilla on July 4th. And so this was the second day, which is often one of the most dangerous days in a heat wave because people are not acclimated to the heat. And then so they're most at risk of injury and illness. And so you can see, for those of you that don't know California, can you see? I'm not sure you can see my cursor, but you can see the nice big purple of Fresno County, which is not nice at all to have purple. And then the county right above that is Madera County. So you can see that both days it was in major heat, and probably parts of it, since this is a county-wide map, parts of it were probably in extreme heat. And Chowchilla, I believe, is over here on the western part of the county, so it may have been in extreme heat. So what happened, and why do I have heat deaths are hard to track? What happened was that CDCR said, well, she was transported to an outside medical facility and she died 2 days later, but it wasn't related to heat. It was related to an ongoing medical condition. And so this is a classic problem. Even if we take sort of a generous approach and say that CDCR is doing their best to report on what the person died from, we know it's hard to track heat deaths because when somebody dies from a heat stroke, they're not going to die from a heat stroke. They're going to die from a cardiac event or their brain swelling. It's not like you can check a box for the coroner to say this was a heat death. And so it's very hard to track them. CDCR is probably one of the least likely institutions to be on the forefront of trying to track, developing diagnoses. They do have a lot of people that are on heat medications. They call them heat meds, and those are medications that make people vulnerable to heat. And so if somebody dies of a heat death, what we would think of as a heat death, related death, they may also have been made more vulnerable because of the medication they were taking, in which case CDCR might report that as something related to the illness that they were taking the heat medication to address. So it's very complex to understand how extreme the problem is. And this is true in the free working world as well as in prisons. And so we have a hard time tracking deaths, so it's hard to know how big of a problem it is. But we can see that there's a lot of heat and it's increasing. And so on the left, you can see the current condition. This is the number of days in 2023 where the outdoor dry bulb daily maximum temperature was above 90 degrees. And so if you're familiar with California geography and climate, these are the places you'd expect, mostly in the Great Central Valley, the desert, but also in the Sierra foothills and to the coast. On the right side, you can see a map of the number of extreme heat days over 103 degrees Fahrenheit forecast by a model assuming a 4.5 representative concentration pathway, the RCP, meaning that we continue to emit greenhouse gases as we are today. And so the highest ones projected in that model, where things will increase the most, are pretty much the same as those observed in 2023. And so you can see that the dots on the right-hand map, or the triangles, are showing locations of CDCR prisons. So it's just the main 34 locations, I believe, in that picture. It's not showing juvenile detention. It's not showing ICE. It's not showing federal. And so these are areas that are going to get very hot. The four that are down in the bottom corner um, are in the high desert. And those actually, I'll talk about a little bit later, are a little bit different and have a different risk as far as heat goes. So CDCR was actually, we passed an indoor heat standard this year for California, but CDCR was cut out of that standard because they objected and said they would not be able to meet the standard, that they did not have the infrastructure and the budget to meet that standard. However, because the usual consideration is that workers in carceral settings must meet the same standards, generally speaking, as though they're entitled to them as people that work in the free world, CDCR will need to bring themselves into compliance with that standard sooner or later. And additionally, there's custody, nursing, janitorial, and lots of other free staff who work in that setting who may put pressure on CDCR. And then another note as we move into, before we move into mitigations, is that these are outdoor heat metrics that are presented here. And prisons, indoor heat exposures are obviously based primarily on indoor temperatures. And CDCR has a heat plan that means when it gets above a certain temperature, which I believe is 90 degrees, they pull people off their outside yards. And so then everybody's indoors. And they're still working in kitchens where it's very hot. They may be working in laundries. They may be working in some of these prison authority situations, such as there's a coffee roaster at Mule Creek. There's knitting mills. There's license plate printing in Folsom. There's metal products. There's all sorts of things. And so where they are and what they're doing may make the indoor heat unbearable. And so in addition, the buildings are like you saw in that first picture, which they're big concrete buildings. They hold on to the heat once it's exposed. And so that heat, even after it cools down outside, is still quite strong in the inside, and even after the sun sets. And I see there's some questions in the chat. I'm just going to say that I'm going to do questions all at the end. So there'll be time for that. But you can keep putting them in chat. I'm just going to try not to be distracted by them. Okay, so moving forward into mitigation. So what can we do? Number one, top of the list is always remove the hazard. So decrease greenhouse gas emissions, stop heating our world, try and take steps to decrease that. Second is to remove people completely from this hazardous condition, eliminate that problem, and that would be to decarcerate, to close prisons in high heat areas, to close hot prison industry jobs in high heat areas. Those prisons that were in the southwest corner and the very south bit of the state, those prisons are in the high desert, and they do have engineering controls, which is next on the list. They do have air conditioning. So an engineering control where you're going to isolate the people from the hazard. You're going to try and cool the air and move people into cooler air spaces. And so there's air conditioners, lots of different types. Some work well, some don't. You need to have infrastructure to support those, which is what the challenge is for those high desert hot locations, is they need an electrical source. They need to be able to keep that electricity going when it's hot, when the demands on the electrical grid are high, and potentially even during fire season when there's other threats to their electricity. Allowing open windows and providing window screens is a very cheap and easy mitigation, but one that is still can be difficult due to different considerations and rules around what inmates can do in their own cell. And then providing fans for air movement to aid in evaporative cooling. That's effective under about 95 degrees Fahrenheit. Over 95 degrees Fahrenheit, it can be counterproductive and actually decrease evaporative cooling. So then the next down the list is administrative controls, which is you change the way people work. So allow people to have more time and access to areas that are cool, like libraries, classrooms, set up cooling spaces within the institution. And we know that custody workers and medical staff are often using air-conditioned spaces, and it's the incarcerated individuals in their residential blocks that are not receiving the benefit of air conditioning. And so have spaces that people who don't live in air conditioned spaces can access. Provide shade structures on the yard. Like that's a rare thing. You can see, here in Chino, there's a extremely exposed yard, and they want it exposed so that they can see what everybody's doing. So think about how to provide a shade structure that also still allows custody to do their job. Um, Provide more breaks during work shifts, just like you would anywhere else. Allow more access to showers if you're in a low humidity setting so that people can take showers to cool off and increase evaporative cooling. And then, of course, educate people on heat illness and reducing heat exposures. And also, I'll say in the education piece, a big piece of what people talk about in the free world and with farm workers especially is that you check on your buddies. And I think that is a method that could be used in this setting, but is not as far as I know. Though I think people do look out for each other. So that's another piece of education, like identifying heat illness in other people would be um, a useful education. And then last, sort of allow time for heat acclimatization during the start of the hot season or during the first heat wave. So pull back on those work hours and let people's bodies adjust so that they're more protected. It won't protect you from the most extreme heat, but it does make you better able to cope with lower heat, that it can still be dangerous. And so then last is PPE, personal protective equipment, always the least effective. We all know this. I don't have to explain it as much anymore now that we've gone through a pandemic together. You saw how well people do with wearing, the respirators, the N95s, like terribly, right? So we don't need to discuss that. But heat, you might be more inclined to use PPE. If somebody distributed those nice cooling vests with ice in them, that would be probably adopted and used, and those might be effective for some people. Custody workers in particular are wearing a lot of polyester gear that doesn't breathe. They're also wearing a lot of equipment. Um, Whatever we think about their job, they still are a worker and they're still in California, so they still should be protected. They might be more able to take advantage of cooling vests. In low humidity conditions, you could hand out cooling towels that are wet or other garments that people can wear that are wet. And then, of course, distributing ice and additional cool water. I will say this takes some thought. You can't just say ice. And I was reading a story about how there was a prison that said, well, anybody can come down to the commissary and get ice, but they weren't giving out containers to take it in. So you had to have bought your own container, or the best you could do was your small cup. So like there's sort of these basic barriers that need thinking through. Um, and so and PPE just bears repeating that it never lasts very long. So you always have to spend more to keep up that investment in PPE. Okay, so the next big climate-related hazard is not one that I have traditionally focused on, and I'm not going to actually talk very much today. Flooding is a very serious hazard for many prisons, including in California, very much in the Gulf Coast region. There's a lot of difficulty in flooding events, both because of difficulty in after the event, but during the event, which is another thing I'm not talking about this talk, is that in most of these cases, not heat, but in flooding, and then I'm going to talk about next wildfire smoke, there's also an acute danger, danger from the flood itself and danger from the wildfire itself. And in general, there's a big challenge with emergency planning and carceral settings because they don't want to share how to get out quickly with anyone. And so it can be tough and it can require a lot of logistics that have not been practiced. And we all know how important it is to practice emergency procedures so that when it happens, you can just do it automatically. And so if it's not practiced, that's a big challenge. And so flooding and wildfires are two of those that are a part of that. And so we have a lot of challenge for that in California, especially in Corcoran. And there are a couple prisons around Corcoran, including the Substance Abuse Treatment Facility, SATF, and those are threatened by Tulare Lake. And I really encourage you to read this a very good story in Harm's Way that really outlines sort of the multifactorial steps that bring about having a prison in a terrible location and the ramifications of that for the people that live and work there. Okay, so the second large exposure that I'm going to talk about from an industrial hygiene perspective is wildfire smoke. And so, as we all know, there's significant wildfire related smoke exposure all over the state. You can see in the image here on the right that sort of the estimated particulate matter of PM 2.5 size and larger and smaller, sorry, the exposure sort of on average during this 11-year period was more concentrated in the northern parts of the state. And that's sort of historically true, that there's a little more that happens, especially in the North Coast range, but also in the Sierra Nevada, both of which are in the more northern part of the state. But there can be significant wildfires also in the south, and I believe there is a Malibu fire going on today, which you can see in this image. There's sort of a little bit of a darkening around there that might reflect sort of a long-term process like that. And so there's also, you could look at this looking at wildfire smoke impact by days, and this is the number of days per year by county in 3 different time frames, how much smoke impact there was. And so you can see that, and if you remember back to what the sort of distribution of the prisons was in the state, this encompasses a lot of the sort of 34 CDCR adult institutions, and of course the other in this, there's every county has a prison, has a jail, and many cities do too. So there's a lot of locations where people are being exposed. So I'm just going to give some mitigations. You know, one of the extra challenges about wildfire smoke is that it occurs often at the same time as high heat conditions, and so you can get a double whammy. It was especially fun during the pandemic when we had threat of outdoor wildfire smoke, and we had a problem of indoor high transmission situations with COVID-19. And so then all of our instruction that you should let in outdoor air as much as possible was a really bad recommendation. And we all experienced that firsthand, how to handle that, both in any institution, whether it was a school or a university or a prison. And so the first step always is try to eliminate, remove the hazard, decrease the greenhouse gas emissions so that we have fewer droughts, we have less hot conditions, things are not going to be as flammable, and also improve forest management. And then, just like with heat, remove people from those hazardous conditions, decarcerate, generally speaking, and close prisons in high-risk areas. Engineering controls are similar to the high heat kind of scenario where you're trying to keep the indoor space clean and decrease infiltration, sealing windows and doors adequately, providing air purifiers. There are often, an air purifier that's also air cooler is a nice, solution. Again, wildfires can be accompanied by power shutoffs, and so that can really challenge the ability to keep the indoor air clean using these kinds of methods. But there really aren't great other alternatives. And so having backup power is a mandatory need in areas where there is high anticipated risk. So administrative controls are very similar. You want to provide access to clean air break rooms, libraries, classrooms, other spaces. You want to provide more clean space breaks for people who are working in polluted air or people who are particularly vulnerable. And you want to educate about respiratory illness and reducing high smoke exposure situations. What happens, how you can reduce high smoke exposure, whether moving air or having someone check on you to make sure that your breathing is okay, are all useful. And then with PPE, we have the same option we had in COVID, which is the use of respirators. N95s are effective at filtering out 95%, at least 95% of airborne particulates of 0.3 microns and larger. And these can be effective against smoke, but handing them out to prisoners can be a challenge. People may or may not wish to use them. In general, when you hand out respirators from N95s to anything more serious, you need to do fit testing and make sure that it fits well so that it works. And then you also need to do medical clearance to make sure that people are able to handle the increased pressure that it takes to breathe through a respirator. And that's a challenge in a prison setting, both parts, the fit testing and the medical clearance. And so I'm just going to wrap up with some somewhat general but special considerations, which is that many of these I'm going to skip because of my comment here. That incarcerated workers are less healthy than free workers. They're under considerable stress. Their quality of life is lower from being incarcerated. They're not getting as good of food or exercise or sleep. Um, so they may have exacerbations of their asthma at a lower level than you would expect somebody in the free world would have. Um, the free workers in prison, especially custody officers, are also less healthy than their counterparts in the free world. It's a stressful environment to work, and that takes a toll on people's health and ability to cope with periodic stressors like heat and wildfire smoke. And then the last is that many of our occupational regulations assume that time that you spend off work, so time at home, is unexposed time. And so that you're getting a break from whatever the conditions are at work because they were written with in mind with the thought of like working in a steel mill, that you have a hot job. And when you go home, even if it's hot out a little bit, it's not going to be like that because you've got your air conditioner, or whatever. So like the all of the regulations we have are really not for these situations. And so while they are a good guideline, they actually are not serious enough to protect a lot of the people that are incarcerated, either free um, or residential. And so last, I just want to point out something that is not talked about enough, which is that there's a lot of people that have sued the various state prisons and federal prisons for cruel and unusual punishment, and they have won some of these cases. And I think that what we need to remember as public health professionals is that acute effects like high heat, where you can die in a heat wave or you can have various problems from wildfire smoke, are important. But there are chronic exposures and outcomes, especially chronic outcomes, that can be attributed to time someone spends in prison. So if you go to prison for 5 years and you're exposed during that time to high wildfire smoke and you know high heat that you normally wouldn't be, those may have lifetime ramifications that go beyond the time that you were sentenced to serve for your punishment. And so those things need to be considered as we think about what we're exposing people to in prisons. And then very last, I will say that this is work that's part of an ongoing project with the Fifth California Climate Assessment, where we are assessing the risk associated with climate-related occupational hazards, so that the state of California will be better able to plan their future budgets and expenditures to protect workers. And I've just listed my co-investigators, some of which are here. And I am going to close. Perfect, so that I can answer questions.